You're listening to Health and Image, where we interview top doctors and experts on procedures and topics you want. Hello and welcome. You're listening to Houston High. I'm your host, Stephanie, and today we are talking about functional medicine. We are going to learn more about it, and I'm actually talking with Dr. Julia Ward, and this is her specialty, so she is going to answer our questions. Dr. Ward, welcome to the show. How are you?
I'm good, thank you.
So let's just start out with, what is functional medicine for those out there who don't know?
So functional medicine is sort of a holistic way of looking at things. Rather than the traditional model of diagnosing what's your condition and then giving you a prescription to treat that condition, it's more of looking at the root cause of why do you have that condition in the first place. So let's take, for example, high blood sugar. Instead of saying, oh, your blood sugar's high, here's your diagnosis. You either have diabetes or maybe it's pre-diabetes, and here's a prescription that's going to lower your blood sugar. Functional medicine takes the approach of, why are you having your blood sugar high? That's not normally something that should happen. So let's look into some of the reasons why. Is it the food choices that you're making? Is it, the lack of exercise? Is it, it's various different things.
Yeah.
But a lot of it does focus on lifestyle and choices that we make.
Yeah.
So it's kind of treating the root cause rather than just the symptoms.
Yeah, I love that. So I would say that's definitely why we need functional medicine in our lives. So what are some of the services that you offer at your practice? Like say someone does find out that they have high blood pressure, for example, just because you just used that, and they come in, how can you help a patient?
So we do a kind of a comprehensive overall view of somebody's health, and we look at various different things, not only traditional lab work, but what we call some functional labs that look at beyond what the traditional medicine is looking at. We also do complete body analysis using a bioimpedance scale. And then we have programs that will kind of help guide people to get to where they want to be in their health goals, and that usually involves a detox program of various lengths of time. And when I say detox, I don't mean like a juice cleanse or some crazy diet that has you going to the bathroom every 5 minutes.
Yeah.
But it's more of a program that has you adding in some vegan-based shakes and using some very specific supplements to add to your diet. And then mainly focusing on the clean, whole, unprocessed foods. So that's where we start. And then that can include hormone balance. We definitely look at thyroid in all of this. Sometimes we'll offer IV nutritional therapy for people that need that little bit of extra nutrition that they're just not absorbing real well from the stomach. And we look at, gut health, because that really influences a lot of your health, is how healthy is your GI system.
Right. So what are some of the reasons that a patient might consider, coming in to see you, besides just like the example that we gave? I mean, what do you see a lot of?
So I see a lot of people who say, I'm feeling tired, worn out, and I've been to my regular doctor and they say that everything's normal.
Yeah.
And I know something's not right because I just don't feel right. Besides the traditional, or some of the more traditional patients I take are like if they're having menopausal symptoms, hot flashes, night sweats, foggy thinking, they can't remember things. That's another thing too. And then also just to touch on the sort of brain health too, we do focus a lot on that as well. And I have a very specific brain function test that people can take, and it looks very specifically at about 8 different aspects of your cognitive function, or how well your brain is working. And so from that, we can make recommendations. So that also is really important, because, a lot of people, myself included, are worried about declining mental health, as far as remembering things. We see all kinds of memory centers popping up everywhere for people. And then it seems like most of my friends have had parents that they've had to deal with as far as getting them into assisted living or some kind of situation because they can't remember things to deal with everyday life.
Yeah, definitely.
And so that's a big concern for a lot of people.
Yeah. So what are some of the benefits that you would say just of, looking for the root cause and how you can treat it versus, like you said, with conventional medicine, just kind of treating the symptoms? How do you feel like that helps the patient so much more?
Well, it's like what I tell people, it's like the check engine light in your car.
Mm-hmm.
You can stick a piece of duct tape over that so you don't see the check engine light.
Yeah.
But if you're not actually fixing the problem,
right,
eventually things are going to go downhill, right?
Mm-hmm.
Your car's going to break.
It's going to get worse.
And so functional medicine exactly is like, well, why is that check engine light on?
Mm-hmm.
We need to fix that problem rather than just taking a medicine that's going to switch the light off for a little bit. Because you notice there's most of these medicines that traditional medicine prescribes are kind of forever deals, right?
Right.
It's not like, oh, here's a high blood pressure medicine and you should only need this for a couple of months and then you'll be fixed. It's like, no, you've got to take it every day for the rest of your life.
Right, yeah.
Same with cholesterol medicine or blood sugar lowering medicine, things like that. So it's really getting to, because my ideal for people is to get them healthy so that they're not dependent on any doctor or any prescription medication, that you just get back to a more natural state.
Yeah, so you can actually help a patient who is taking blood pressure medicine every single day to where they don't have to do that anymore?
Correct. Yeah.
Wow. That's definitely amazing. So tell me, what made you want to get into this specialty and really focus on functional medicine?
Initially, it was just my own desire to look into bioidentical hormones for myself. And when I asked my GYN doctor about them, it was clear from her answer that she didn't really know that much about them.
Right.
So when I started researching bioidentical hormones, like what are they and why would I want to be on them? What's the difference between that and regular hormone therapy? Mm-hmm. I found that's when I stumbled onto this world of functional medicine. And I learned that bioidentical hormones is just a small part of functional medicine overall. And it just made so much more sense to me.
Right.
Looking for the root cause and treating that instead of just chasing symptoms.
Right.
So that's kind of how I got into it, was looking at bioidentical hormones.
Okay, well, I'd like to thank Dr. Ward for coming on today. If you have questions for Dr. Ward, be sure to reach out to her office. They would be happy to help you, or you can also ask a question right on the showcase page. You can also check out the ebook on functional medicine as well. Until next time, thank you for listening. Okay, Dr. Ward, you did fantastic. So we're going to go on to the bioidentical hormones.
Okay.
Do you do a lot of speaking? Events?
Well, I'm starting to do some more speaking with these dinner presentations that
I'm doing. Yeah, that's what it is then. Because I can tell you're like super smooth, and that went really well. Yeah, you're doing great. Okay, so we will go on to this one. Here we go.
Okay.
Hello and welcome back. You're listening to Houston High. I'm your host, Stephanie, and in this interview, we are discussing bioidentical hormones. I am talking with a premier doctor, Dr. Julia Ward. Dr. Ward, welcome back. It's always great to have you. How are you?
I'm good. Thank you very much.
So why don't we just start out with, what are bioidentical hormones?
Great. Yes, bioidentical hormones are hormones that are chemically identical to what our bodies produce.
Okay.
They are plant-based, so they're mostly made from yams, and they are, like I said, they're chemically identical to what the body produces. Okay. This is in contrast to what what we may think of as traditional hormones, like Prema and Provera. Those are synthetics. They actually are based on pregnant horse urine, and so they're not even similar to what our bodies would produce. Okay. So that's the big difference.
Yeah. So tell me, why might someone need to get hormone replacement?
So I tell people that the main benefits from being on bioidentical hormones is, besides the relief of the menopause symptoms, the hot flashes, night sweats, foggy thinking, irritability, all those kind of symptoms, because those symptoms, you may or may not have them. Not everybody's going to have them.
Right.
However, taking bioidentical hormones prevents, number one, it prevents memory loss, which is really important. I know for me, and I know a lot of people are concerned about memory loss. Number two, it's really beneficial for cardiovascular health.
Oh, wow.
And number three, for bone health as well.
Okay.
So, so that's really the benefit.
Yeah.
As our bodies get older, as we age, we get less, we produce less and less of the three sex hormones, the estrogen, progesterone, and testosterone. And it makes sense because as we, push beyond 50, our bodies are no longer interested in reproducing, right? So it's naturally, those hormones decline, it's sort of shutting down for the inevitable, right?
Yeah.
So, but the cornerstone really of anti-aging medicine is to provide bioidentical hormones at youthful levels so as to maintain memory and cardiovascular health, bone health, skin tone, muscle tone. It's just a way of maintaining all those things.
Yeah, that's really eye-opening because when you hear bioidentical hormones, some people might be thinking, oh, it's just for people who have menopause or, they're just dealing with those symptoms, but it's for so much more. So you mentioned doing it maybe younger. Is there a certain age group that you see doing this or?
So typically, women who are what we call perimenopausal or around that menopausal age will benefit from this. And in perimenopausal, women can go into menopause anywhere from age 35 to 55.
Yeah.
So it's a pretty wide range. And it's really difficult to tell, when you're going to do this.
Yeah.
Sometimes you can look and see when your mother went into menopause. But, like for me, my mom had breast cancer, and she was like 42 when she had that. So there's no telling when she would have gone into menopause.
Yeah. Right.
So some people just don't know, or another misconception too is people say, well, once I'm through menopause, then I won't need it anymore.
Oh,
and
yeah.
say, well, you're never actually through menopause. When you go, we have those symptoms that people associate with menopause, but unless your body starts picking up the slack and starting to reproduce hormones, the sex hormones, the estrogen, the progesterone, testosterone. Again, like you're 20, you're never going to be done with menopause. It's kind of your body's just done making those sex hormones.
Right.
But there's those
Go ahead.
other reasons to take the hormones and be healthier.
Definitely. And so can you kind of walk us through, what is the process like of going through all of this and coming in and seeing you and just kind of walk us through that?
Sure. So when people come in, we sit down for an evaluation. It lasts like an hour to an hour and a half. And we talk about there's different ways of giving you back those hormones. One of the main things is we don't want to take estrogen or testosterone in a pill form because that can cause liver inflammation. Liver inflammation will lead to things like high blood pressure, increased weight gain, just to name a few.
Yeah.
So you want to either take the estrogen and testosterone either in a cream that you rub on twice a day, or I can insert a pellet under the skin, which gives a steady state release of hormone over the next 3 months.
Okay.
Both methods, you're going to take an oral progesterone, and there's a couple reasons for that. One is that the oral progesterone makes you sleepy, which is a bonus. You get a good night's sleep. And number two, there's some breast protective effects as well.
Okay.
So we kind of talk about which way a patient would like to go.
Is the pellet painful at all?
Is the
pellet painful at all, or is it a pretty easy process?
No, it's a very easy process. It takes less than 5 minutes.
Oh, okay.
I just numb up your skin and literally just put it in just below the skin, and it sounds worse than it is.
Yeah.
It's really not painful.
That's why I wanted to ask. Okay, so back to what you were saying. I'm sorry to cut you off.
Yeah, no. So everybody's different. I would say the majority of my patients do prefer the pellet because, you don't have to remember to put it on. It's, there's no mess, all that kind of stuff. Plus, you're going to get to more energy and clearer thinking faster than you would with the cream.
Gotcha.
You can still get there with the cream, but it's just also with the pellet, there's a little bit ease of monitoring your levels. When you have the pellet, we can monitor your plasma level of the hormones real easy and accurately. Whereas if you do the cream, we really have to do either a saliva test or this dried urine test to measure accurately what the tissue level is of your hormones.
Gotcha.
So it's a little bit extra, like an extra step in there as far as testing.
Yeah. And so how often, I know you said like the pellet can be for like 3 months, but how often would a patient need to come back and get, continue to have the hormones?
Well, how long they want to continue doing the bioidenticals is totally up to them. There's no downside. Like if somebody, turns, I don't know, 80 or 90 and says, I just don't want to do the hormones anymore.
Right.
There's no downside. Their body's just going to go back to what it was before, which is having pretty much no hormones.
Gotcha.
But there's no downside to starting hormones or continuing hormones for years.
Gotcha. So it's basically like if they want to keep having those benefits, they need to just keep coming in and seeing you, basically.
Correct. Yes.
Gotcha. Okay. Well, I know there's so many more questions that people probably have, but is there anything you feel like we left out that you want to include?
No, but I encourage people to please, click on the form and ask me any further questions that they may have.
Oh, definitely. Well, this has been so fantastic. So thank you for coming on today. Like Dr. Ward just said, if you do have questions that we didn't cover, be sure to ask online or you can reach out to the office. We also have an ebook on it as well. So until next time, thank you for listening.